I'm Scott Weese, a veterinary internal medicine specialist who deals with infectious diseases at the Ontario Veterinary College. Infectious diseases are a big challenge in the horse industry, whether it's a single horse on a farm that never sees other horses or a large breeding farm with regular international movement. There's always a risk of infectious disease exposure. And what we're trying to do is reduce problems associated with that, preventing diseases and containing them when they occur. So a question about what is biosecurity in horse farms, and one of the questions I actually rephrase first is, do we actually do biosecurity in horses, or do we do infection control? Biosecurity really is trying to keep bugs from getting onto a farm. And we do that with chickens, we do that with pigs. We can't really do that with horses because we take them out to different shows and races and they encounter other horses. So we're always doing things that let a horse bring something infectious back to the farm. And by the nature of what we do with horses, we have to do that. So what we do is infection control. We're trying to reduce the risk of problems that can come up just from what we normally do with horses. So infection control is there to reduce the risk and the occurrence of infectious diseases, but we know we can never 100% eliminate them. So infectious diseases have been around for a long time, and they're always going to be around. And the risks for individual horses and individual farms are really going to vary depending on what they do, whether they have a closed herd where they don't really go anywhere, whether they have brood mares versus older horses, whether they go to shows and mix with a lot of horses. But we have some general themes that we see with infectious diseases. We have the diseases that are present in the horse population at all times, things that can live within a normal horse, a healthy horse, but cause disease given the right circumstances. And we also have infectious diseases that are transmitted between horses fairly widely in the population. Something like equine influenza or something like strangles, where encountering a new horse that's carrying that infectious agent can cause disease in the animal or on the farm. Then we also have emerging issues, new diseases that might be coming up, might be uncommon but increasing of concern, diseases that might come out of nowhere and pose a risk to our horses. So emerging infectious diseases are always a concern, whether it's horses or people or any other species. It's something we have to pay attention to. The problem with emerging diseases is we don't know what's coming. We have a few different areas we pay attention to. We have current diseases that might change. Equine herpes virus is a good example of that, where in the past few years we're seeing a lot more outbreaks and a lot larger outbreaks because maybe of some changes within the virus. We also have the antibiotic-resistant bacteria that are becoming a big problem in horses, such as resistant staphylococci. Now, these are big problems in people, and now we're seeing that spread into horses, something that's building up over time. We also have infectious diseases that might be changing because of climate change, as we see warmer winters, where we're not getting as many parasites killed in the environment. Or we see changes in wildlife and ticks that can carry infectious disease. So as climate warms up, we can see diseases changing their range and moving into a new area. And then the other class of emerging disease is the truly emerging disease. West Nile virus, a great example. This obscure virus that was found in another continent that all of a sudden came in and wreaked havoc in North America. And we're always at risk of new emerging diseases that maybe occur somewhere else, or diseases that have never been identified before that come out of nowhere. So every horse owner and every farm should have an infection control plan. It doesn't matter if it's one horse or 100 horses or what they do, they should have a general idea of the measures they take to reduce the risk of infection. And part of that is dealing with a veterinarian to come up with ideas, and that can include cleaning and disinfection and testing of horses when they're sick, moving horses around. It's a whole range of activities, but having that basic infection control plan in place is probably the biggest thing someone can do to reduce the risk of disease. Understanding your horse is very important. There are certain conditions that will make a horse more susceptible to an infection if they get exposed to a bacterium or a virus or whatever. So understanding what your horse is at risk for is very important for developing a preventive strategy. Now, vaccination is always an important part of infection control. Often we rely too much on vaccination, but vaccination is really important. And there are some infectious agents that are going to get onto the farm or get into the horse despite what we do. And vaccination is there to clean up that mess once the infectious agent gets by all the other things we try to do. Now, vaccination is really variable between horses and between farms, and there's no standard vaccination program. But communicating with the veterinarian to figure out what diseases are of concern, what horses on the farm are of particular concern, risk aversion, timing of vaccination is a whole series of things people need to think about, and having a good talk with a vet to determine the optimal farm and horse-specific infection control program is really the key. Clean hands can be very important for infection control. It's often said that these are the 10 most important things for infectious disease transmission. Because what do we do with horses? We have contact with their nose where lots of bacteria and viruses can live. We have contact with manure, with various parts of their body, and then we go and do that with various other horses and their tack, and touch our clothes and touch ourselves. It's a great opportunity to move things around between horses and from horses to us. And the simple step to stop that is wiping things off our hands with good hand washing or use of an alcohol hand sanitizer. A thorough hand wash with soap and a good drying effect, or use of an alcohol hand sanitizer that's very easy and very quick to do, can probably have a tremendous impact on disease transmission on farms. Feet can easily track things around a farm and between farms. We step on manure, we step on other secretions from horses that might have bacteria or viruses in them. If we don't clean our feet, it's the potential for transmission across the farm, to take it home, or to spread it to other farms. So having clean footwear can be an important part of the infection control program. Some farms will use foot baths or foot mats. Mats are baths that are soaked in a disinfectant so that you can step in that and disinfect the bottom of your footwear. Those can be useful in some circumstances when there's a high-risk facility, such as a broodmare population, young foals, as long as they're handled properly. And the big problem with foot baths and foot mats is when they get dirty, full of debris and manure, and the disinfectant really doesn't get work, or when people don't use them. So they're really something that's used in select situations, and if nothing else, sometimes they increase the awareness with the recognition there's a foot bath here, a foot mat here. Yes, we're paying attention to infection control. There might be something that's of greater risk here, so I better take better precautions. Well, every horse is carrying billions, if not trillions, of different bacteria and viruses that could cause an infection in another animal in certain circumstances. Usually it doesn't happen, but we never know which horse for sure is shedding something that might be of concern. So we want to do routine cleaning and disinfection practices to reduce the risk. And then in some situations where we have sick animals or a greater concern, we want to use enhanced practices so we do everything we can to reduce the risk of transmission. Barns can be very difficult to clean and disinfect. Pastures and paddocks can be difficult to impossible. But what we're trying to do is reduce the burden of bacteria, viruses, fungi, and other organisms. We're never going to sterilize a barn, but what we can do is bring the levels down to a lower level that's probably lower or no risk to individuals. We can do that, importantly, by cleaning first to remove the debris, and then following that up with disinfection that lets us kill any residual organisms that escape our cleaning. Any new horse increases the risk. Any horse can be carrying various infectious agents, and moving them, shipping them, bringing them to a new location causes stress that can make that risk even higher. But there are a few things that we can do to reduce that risk. One is knowing as much as we can about the horse, understanding its health status, what it's been exposed to, what it's been vaccinated against and dewormed against, so that we understand the risks and can take extra measures if possible. Before the horse arrives, we should have a plan of what to do, how to handle it when it gets here, how to prevent it from having contact with other horses at the start, and an isolation and monitoring plan. Once the horse arrives on the farm, we want to keep it separate from other horses for a while, at least a couple weeks if possible, to let us see whether it's incubating a disease that might be of concern, to let us understand its health status, and ensure that vaccination and deworming is done properly if we're unsure of it's passed. And then we want to have a controlled entry into the rest of the group so that we reduce the risk of transmission of diseases if there's something that's slipped by all our earlier efforts. While horses pose the biggest risk of bringing something onto a property, anyone that comes on can carry something with them, especially if they've come from a horse farm or have had recent contact with a horse, and especially if they've done that with the clothing and footwear that they wore when they were on those farms. So a lot of it comes down to some basic plans. Identifying high-risk animals on your farm that you want to keep people away from. Pregnant mares, young foals, animals that are sick. Part of it's understanding what people might be at higher risk and having some recommendations for them. If they're coming from a horse farm, make sure they're not wearing the same clothes, same footwear, and make sure they've washed their hands or used a hand sanitizer. Once they're on the farm, it's just common sense practices, not letting them have contact with a lot of different animals, especially serially down one horse to another. They might spread things, and having them do some very basic practices like washing their hands or using a hand sanitizer between horses. So anytime a horse goes off the farm and encounters other horses, it comes down with a chance of getting exposed to an infectious disease. Just like any time a person goes in public, they might get exposed to influenza or anything else. Now, that's an inherent risk when we go to shows and races and other events, but there's some really common sense things we can do to reduce that risk. And a lot of that really is reducing the amount of contact that a horse has with any other horse. And that's direct contact, not letting them go nose to nose. That's indirect contact, not sharing water buckets or sharing other types of equipment, and keeping people that have been handling lots of other horses from handling your own horse. So again, it comes down to the idea of trying to prevent something from making it from that horse's nose or skin or intestinal tract onto or into your horse. Trailing horses can pose some risk for various reasons. Horses can be stressed, they can go without water for times, they can have their head in abnormal positions, and they can be exposed to infectious agents from other horses that are on the trailer. And there's some things we can do to reduce that risk. One is trying to avoid shipping with horses from other farms. If they're shipping from a horse on your farm, they've probably been exposed to each other, and the risk is probably much less than horses from other farms, especially multiple horses from multiple other farms. When we are trailering horses, some very common sense procedures that are widely recommended on how to trailer horses are important, such as how their heads are positioned, how much rest they get, so that all the bacteria and viruses that are floating around in the air and that are in the horse's respiratory tract don't get breathed down into the lungs and cause problems. Another thing that's important for people to consider is what they do on the farm with their horses. So one of the big concerns that we see is horses that are going off the farm, mixing with other horses and coming back. And those horses can be a prime source of infection. So as part of the overall infection control plan on the farm, determining how to handle those horses, ideally involving quarantine. So when a horse has gone off the farm and comes back, some way of keeping it away from other horses on the farm, or at least all the other horses or high-risk horses, such as brood mares and young foals, so that if that horse brings something back to the farm, it doesn't have as much chance of spreading and causing wide problems. One of the most important things anyone can do is develop an infectious disease control plan and walk through the farm and think about that plan. Something as simple as going through and identifying areas that maybe just don't make sense when you think about it from infectious disease transmission. Inability to wash your hands, inability to isolate horses, no control over mixing of different groups. There are a whole range of things people can think about. And if we can identify 2 or 3 little things to address, that can be a big advantage. As well, working with your veterinarian to develop vaccination programs, deworming programs, programs for disease control when you have sick horses or new horses can be very useful. And it's much, much better to do that before there's a problem than after a problem has occurred.